Thank you very much, David. And today we have some excellent speakers. I'd like to introduce Professor Tim Dafforn, who has established himself as an expert in biophysical spectroscopy with a keen interest in synthetic biology. Tim is a professor of the School of Biotechnology at the University of Birmingham and has developed a number of projects from inception through to commercial realization, and is currently the Director of Knowledge Transfer for the College of Life and Environmental Sciences at the University of Birmingham. It's a pleasure to have you, Tim, and we look forward to learning more from you. Over to you.
Thank you, Ravi. So can you see my slides? Is that clear? Yeah, good. Yep. Thumbs up from Paddy. Yes, so thank you very much for the invitation. It's great to speak here. In fact, it's also fantastic to hear David's words. I used to work in government in the past, working in Bays, and I always said that the Midlands had a biotech cluster and certainly a biomed cluster. And it's great to see it actually happening and being brought together. What I'm going to tell you about today is actually a bit of a collaboration which was initiated by the crisis. And it really hopefully shows you how Birmingham and the Midlands work so well as a centre of maths in bringing together both academic knowledge at the highest level, given the great universities we have, and also small businesses based in the sector, and how together we've managed to produce a real synergy and hopefully some new products as well. So I'm going to tell you about how we developed a rapid COVID-19 test. This is the nasty beastie that we're all is causing a horrible time around the world at the moment. This is the SARS-CoV-2 virus itself. It's a complex beastie in many ways, but the thing which we're interested in and we'll start talking about is the DNA, or the RNA rather, the RNA genome, which is within the virus itself. So this is the world as we've known it for some time, and it's repeating waves of viral activity within our various regions. And in fact, some of those of you who might have come on the call earlier, we were trying to discuss whether we've got 2 waves or 3 waves, and they've almost one wave blurs into another. But these data which show the cases are really related to us having great diagnostics and the ability to measure where the cases are. If one thinks back, or not in our memory, but back to earlier pandemics, particularly things like the Spanish flu pandemic, we really only are able to tell where the pandemic was by people who were coughing and showing the symptoms. But we've known now that our diagnostics capability have improved hugely, and we can actually see where pandemics are. And this is a crucial part to our monitoring of the pandemic. I know that NHS track and trace has bad name, but actually when it comes down to it, the amount of tests being done in the UK has been pretty phenomenal. And it's incredible to me as a person who works in diagnostics to realize that people now know what a lateral flow is. They even might know what PCR is. And that knowledge of testing is something which I would see as actually quite a benefit out of the whole pandemic itself. So I'm going to take you through this a little bit about where the limitations are in the tests and how we try to fill it. So this is the test that many of you will know, love and hate, which is the lateral flow test. Now this is a test that detects the presence of genes via antibodies. It's based on the tests used for pregnancy testing. It has some fantastic attributes. It's simple, really quick, relatively quick to produce, it's low cost. We have a very good strength in the Midlands here with people like the binding site in this area. So it has some Midlands input here as well, but it has some bad points. Its sensitivity isn't the best. And there's been lots of arguments in the press and amongst academics, some of whom were in Birmingham, about just how good this test is. And it's also limited in its differentiation between variants, which is something which is becoming quite important at the moment. But it has really revolutionized the way we look at pandemics. There's also there can be a bit of an issue with how you actually run the test as well. I noticed my son, who now has to do them twice a week, is no longer shoving the swab quite as far down the nose as he should do, which is an interesting one about human beings and testing. This is the gold standard that people talk about, which is PCR testing. This is testing for the genome within the virus. And it's a fantastic approach, fantastic method, incredibly sensitive, and can differentiate between variants. But the issue is really what you see on the left-hand side. These are generally in big instruments and kept within the laboratory as well. So not something which is easily deployable in the community, and certainly can't be used by untrained personnel. So you've got this dichotomy. You've got lateral flow tests, which can be deployed anywhere. They can be sent through the post and used by anyone relatively successfully, but aren't the most sensitive. On the other hand, you've got a highly sensitive test, the PCR test, that is restricted to laboratories. So that means that you have long communication trains and slow times to response. That means you can't respond in the way you want. But we play with this idea, can we develop a PCR-based test that could be used in the community? So can we combine the specificity and selectivity of the PCR test with the utility of the lateral flow? Now, the story I'm going to tell you is a sort of half story, and I apologize for that because we're still on the development phase and hopefully we'll get there eventually. But it shows you how we've managed to make some really significant progress working with an SME. This is the fundamental problem, and I'm not going to go into it too much detail. It's a bit techie, but basically there's a two-stage process in the PCR test. First, take the RNA out of the virus, you have to change it to DNA, and then you have to amplify it so you can see it. And total process time of 60 to 90 minutes. And in fact, there's a beautiful piece of work where someone recently took all the tests that have been published and timed them all, which is data that we all wanted. And this is interesting. I don't know whether any of you have noticed, but if you listen to Radio 4 in the morning, there was a phase where everyone was claiming that their test was taking 10 minutes, 12 minutes. Actually, we're all very good at overselling our tests. And often we miss out various elements like, oh, first you need to process the, then you need to heat treat it, then you need to purify the material, then you put it. What's interesting here is you can see really the PCR test inevitably takes over an hour. And as I say, it's very much lab-based. There's these LAMP tests, which are supposed to be the improved, maybe slightly quicker ones, but they're still taking mainly an hour. This guy down here is just the amplification with none of the pre-processing, so probably takes an hour anyway. And then there are some cooler, newer technologies, which bizarrely take a lot longer, but give you better data. So we're still pretty stuck technically with a test that takes 40 minutes to an hour, and 40 minutes to an hour is not deployable in the community. If you work in point of care testing, you'll know very well that you need a test if you're doing point of care. It's say even in a doctor's surgery, which really needs the results in 5 to 10 minutes. Otherwise, your patients are going to stack up. We thought, let's see if we can develop something. And so we had a project, and the project was collaborating with Linear Diagnostics, a company actually founded with Matt Hicks, which is on the call. We had some things that we thought were useful here. And we also had a group of people who really were driven to do this, which included academics, PhD students, and also the company. This was in March of last year. So we wanted to develop a test which was fast, operatively used, but also compatible with instrumentation that they use in labs, so it could be deployed both sides and could be used in the community. And we had we resulted in a test which we called RTF. Not going to go into how it works, but essentially it was some clever jiggery pokery with using enzymes and various. And it was based on a very fast way of amplifying DNA. This is a fast way that Matt at Linear Diagnostics and myself have been playing with some time. And whereas conventional methods, even the fastest ones, take 20 or 30, this method called XPAR takes only 4. We already had something which was quite. It's a two-step process, as I said, to do these diagnostics. And the first step was slowing us down. The first step was always 30 minutes or 20 minutes. And then the second step we could make fast. So we needed to speed up the first step as well. And to do that, we invented a whole new way of taking the RNA, which is in the virus, and turning it into something that we can. I can go into the details about this if you want afterwards, but basically to say we cut that timing down considerably. We ended up with a new test in the initial phase, which was 2 steps. You add one chemical and then you let it run for a while, and then you add the second chemical and you get a result. And the total time for this test was 10 minutes. Now look, that's immediately a great advantage. That's going from 40 to 10, which we thought was phenomenal. But my PhD student, Jake Carter, who's turned out to be this phenomenal, massively hardworking person, said, look, we can do better than that. Why are we doing one test, one step than the next? His view was, a normal human being can't pipette. So you need to have a test where you just have one sample and one reagent, you mix the two together and get a result. We thought, well, it'll never work because these sorts of things are quite complicated. Lo and behold, what he did was he mixed the two reagents together to make a single reagent, added the virus, and we had a total assay time of 4 minutes, which is phenomenal. So that's going from something which is 40 minutes at minimum to something which is, and it's really all down to this student really, fantastic. What's really interesting as well is it's hugely sensitive. So it's no good having a test that takes 4 minutes if it can't detect it in people. carriers. And so we did some sensitivity testing. And in fact, our latest data says it's as sensitive as PCR, perhaps even more sensitive. So now you're really combining things, something which takes less than 10 minutes, that has the sensitivity. Very excited about this. But then the medic said, yeah, that's fine. It detects COVID, but it could be that it detects other viruses that are in, or other pathogens that they get in samples. And that would be bad. If you've got a cold and you come in and we do a detection and it says you've got flu, you're not going to be very happy. We took a screen of all the major other pathogens that cause disease, which here, and we screened them using our system. So the yellow lines are the lines below which we see it as a positive. So these are our positive controls for the virus, for SARS-CoV-2. And then all the rest of these are pathogens that you find commonly in the environment, in people who have respiratory disease. And as you can see, they're all above the positive line. So not only is it sensitive, but it's selective as well for SARS-CoV-2. So really happy about this. So in summary, we've got halfway there. We've got a test that takes less than 5 minutes, and we're currently working to deploy this. We could just deploy it in the NHS, let alone going into community. We increase the throughput of the NHS labs hugely. Their total assay time's an hour, and we can do it. That's immediately a big benefit. What we're now looking at is how to minimize the instrumentation, working with some of the SMEs, and have some thoughts about how to integrate it into disposables, but actually relatively easily. And we've actually just asked the government for money, which we're waiting on, to try and help us do that. And we're also looking for investors. But key, we've got a single reagent, which is exceptionally simple. It doesn't react with anything to do with human samples apart from the virus, and it doesn't react with other pathogens as well. And hopefully, before long, you'll have something which can have the sensitivity and selectivity of PCR, but in your hands to be used for detecting COVID. Thank you.
Thank you very much, Tim. That was really informative. I think your microphone might have broken up a couple of times there, but we got a lot of the key messages, which was the timing of the test being brought from 40 minutes down to 4. But if anybody's got any questions, I'm sure they can raise it at the panel session. So now I'd like to invite Professor Lawrence Young, who's from the Warwick Medical School. Professor Young is internationally recognized for his work in virus infection. He's currently a professor of molecular oncology and the director of the Warwick Cancer Research Centre at the University of Warwick. Before joining the university, he was Pro-Vice Chancellor and head of the College of Medical and Dental Services at the University of Birmingham, and he is listed among the world's most cited scientists in the ISI's list of highly cited researchers. Over to you, Professor Young. Oh, can't hear you. Are you there, Lawrence? Was your mic on mute? Checking. We can see your presentation, but we can't hear you. Let me see if I can
hear me now. You can hear me now, can't you? Sorry about that.
Yeah, we can hear you now. Thank you.
So I'm going to touch briefly on a couple of developments at Warwick, focusing on a couple of novel approaches to diagnosis, but also talking a little bit about prognosis. I'm not going to go into too much technical detail, but I do want to highlight as I go through how important networks are and collaborations are, and how, as we know through the COVID pandemic, it's really put that global dimension on collaboration into sharp focus, and how we should all be working together. And I think we should be, in the West Midlands, a microcosm of that, really. We are lucky at Warwick because what we've been able to do under the auspices of our Global Research Priority Initiative is bring together all health-related activity under one umbrella. And it's that has facilitated a number of developments related to COVID, some of which I'm going to talk about today. So we've heard from Tim a nice sort of overview, really, of the importance of molecular testing, and obviously that specific test that he's developed. There are pros and cons with testing, and the two big testing that we're hearing a lot about at the moment are molecular testing for the virus itself to detect the viral nucleic acid, and serological testing to identify individuals who've been infected and have mounted an immune response to infection. And as you can see on these slides, there are pros and cons. Probably the biggest con with the molecular testing is the fact it doesn't tell you if you've actually got live virus. It only tests, it's looking at the viral nucleic acid, and there's lots of confusion in the literature actually about this in terms of long-term shedding and persistence of infection or otherwise. And in between these two, molecular testing and serological testing, there's antigen testing, and that's the lateral flow testing that that Tim mentioned, which is mainly focused on seeing virus itself, seeing the virus particle, and demonstrating that an individual is actually shedding live infectious virus. And I want to talk about 2 tests that have been developed by colleagues at Warwick around that, and then go on a little bit to talk briefly about the prognostic side and the value of that engagement across the NHS and academia. So Nicole Robb, who joined us at Warwick from Oxford last year, is a virologist, and she's been working on a very clever technology that she was already developing, which is to do with actually just labeling the surface of the virus itself. So the viral nucleic acid is wrapped up in a coat, and what she's been able to do is develop DNA probes to bind to that coat, and then to use a very clever basically based on neural networking, a very clever artificial intelligence device to classify the virus through imaging. And it's a very rapid technique. It literally takes 1 minute. So you can actually take a sample, a swab, and you can label it very rapidly with these probes, view it down a microscope. The computer does that, you don't do that. And then basically classify that sample in terms of the number of virus particles, and you can get a result very quickly doing that in a minute. And I, to be frank, was extremely skeptical about this approach, knowing a little bit about viruses, but it turns out it works really effectively and very, very sensitively, and also has very high specificity. But it has another dimension which I think is really intriguing, which is it can distinguish between different virus types very quickly. So what Nicole's doing now with colleagues at Oxford is obviously seeking investment to further develop and roll out this technology. But what's important is that she's been able to distinguish different virus types within a single sample very rapidly, so she can differentiate between a sample from the oropharynx, from the mouth, that might have SARS-CoV-2, it might have influenza, it might have rhinovirus, but she can also, in recent data, demonstrate differences in variants. So she can actually detect SARS-CoV-2 variants. We're hearing a lot about those at the moment, and obviously we're all concerned about the spread of these variants and what that means both for infection, but also for the efficacy of current vaccine. This technology, this rapid detection technology, lends itself very readily to being able to measure the different virus types. Another technique that's being developed is really based on that lateral flow technology that Tim so nicely described earlier on, and it's work from Matt Gibson and his team in the chemistry department. Matt's very interested in sugars, basically. And what's interesting is you can see on the top right-hand side here is the virus coat. We've heard a lot about the spike protein, and that spike protein actually combines sugars, essentially. And what he's been able to demonstrate is, with high specificity actually, is being able to use the glycoproteins to anchor the virus and to bind the virus, and then and from that develop a lateral flow device. I think we should come on to a discussion about this, because as Tim illustrated, there are loads of diagnostics that have been developed. And again, I'm quite concerned about whether any of these will ever be of value in routine diagnostics, and how do you make decisions? And certainly from an investment perspective, how do you decide what's going to be valuable and what's not going to be valuable? This type of technology is really exciting, I think, but I think it also needs to be put into a context of how it would be useful alongside current lateral flow devices, current techniques for detecting the virus. And so what Matt's been able to do, and he's published this now and filed a patent, is actually demonstrate that this approach, which is again very straightforward, very simple, quite easy to operate, so you don't need to be technically trained to do this, and obviously is based on the sort of pregnancy testing type kit approach. How valuable is this going to be in the context of COVID-2, or in terms of future ways of demonstrating and refining detection technologies, is something that we might want to discuss, particularly from a commercial perspective. I just want to finish now quickly by talking about the sort of prognostic side and how valuable it is to be working in partnership. And And without going into too much detail, the issue with COVID, of course, is that there are two phases of disease. There's an initial infection when the virus gets into our bodies and starts to grow. And as the virus penetrates into our lungs, it creates an immune response. And it's that immune response, that overreactive immune response, that is causing the damage and actually is responsible for severe disease and death. So understanding that in more detail has been a great focus of activity around the world, and seeing whether or not we can identify markers that might predict how somebody is going to respond to infection, and could also be used to monitor the impact of various therapeutic interventions. And it's been a privilege actually to work with colleagues at the hospital in Coventry, because very early on we were able to use the biobanking expertise at Coventry Hospital to start to collect samples, not knowing at the time how valuable this would really be. But actually, I think we know from work across the region that this is something we're really good at, actually. The biobank at Birmingham University is fantastic. This biobank, which is embedded at UHCW in Coventry, has been working for many, many years. And I think it provides a very unique opportunity for us to use collected samples in different ways. And I think this is exemplified really nicely by the fact that we were able to collect more than 20,000 samples from 4,000 patients. And this has got on the radar now, and many people are approaching us now to access samples. These are swab samples, these are blood samples, and we've been doing a lot of work ourselves on the blood samples. And I'm not going to go into too much detail other than to say that we, like other folk, have been able to identify sets of markers in the blood, sets of biomarkers that allow us to determine whether somebody's going to develop severe disease or not. And that's quite an important factor. And it helps us also think about different types of interventions. So demonstrating this here is really what we've been able to do, looking at a set of biomarkers and then using the colleagues who are really good at sorting out the data. So they're using, again, neural networks, machine learning type technology, and being able to map these differences and changes in different groups of patients has been extremely valuable. Not only has it been able to impact on the way that we routinely treat patients, but also identified opportunities for novel interventions. And again, using sophisticated analysis, we've been able to start to look at this in terms of patient trajectories. So we've been able to use samples, multiple samples taken from the same patient, to identify the course of that individual's disease, and to then identify markers that will allow us to come up with a signature that will determine how somebody is going to develop disease and respond to therapy. And we've been able to do this because of this setup that we established in collaboration with pathology colleagues at UHCW, which is an Institute of Precision Diagnostics and Translational Medicine. What the guys at the hospital have been able to do is work together, not only in developing this wonderful biobank, but also collaborate around the country in validating tests. So this lab, all the while through the whole COVID pandemic, has been one of the centers that's been evaluating different PCR tests and different serological tests. And we're able to use that expertise to forge better engagement, not only across universities and with other NHS trusts, but also with industry. So I just want to finish by thanking my colleagues across the NHS and across UHCW. And again, to demonstrate that I think something we're trying to do with the health technology cluster here is bring groups together from across the region, recognizing the enormous strengths that we have, but also the enormous opportunities to work not only in partnership across academia and the NHS, but also with commercial partners. And I'll finish there. Thank you.
Thank you very much, Lawrence. That was fantastic. I'd now like to introduce Dr. Paddy Murphy to chair the discussion session. Over to you, Paddy.
Hi there. Thank you. Thank you very much, Ravi. Thanks, Tim and Lawrence. It always makes me feel slightly panicky that I come to these events and I realise how little I know about what is going on across this patch. And it's my job to know what's going on across this patch. And it's always fascinating that there are things that there seems to be no shortage of good ideas, good technologies, and good proof of concepts. But we have not yet managed to plant our flag as a diagnostic centre. What has been stopping us?
It's an interesting one. I mean, I wonder whether it's a combination of, I think in some ways it's what you've set up there. The healthcare technologies cluster is probably what we need. It's just to link people together. So as Lawrence says, there's lots of really nice clinical information there. We've got amazingly diverse community in the West Midlands. We've got technology companies, but we've not always been nicely coordinated across the piece. And you need that tight coordination between the university base in terms of the technologies, the companies that are around the SMEs, and then you also need the clinical information, and getting those work together, I think, will be good.
Yeah, I agree with that. I mean, I've always said that one of the problems I think we've got is that we don't shout loud enough. I think there's something about a West Midlands mentality that is a bit sort of, we're just a little bit shy, perhaps. We hide lights under bushels, and I think we've got to really be out there a lot more and be a lot more confident. I've always been concerned, and we are generally for academia, let alone anything else, that when government looks up from London past Oxbridge, it sees the Northern Powerhouse. It ignores us, and I think that's a real issue for us. I think there's something about us getting over ourselves a bit more as well, and making sure we collaborate more, and that actually universities should not be competing with each other. We're all in different spaces, and there's no need for competition. There's important need for collaboration, and that doesn't only I think that's not only specific to universities, it's also about how NHS trusts work together. I do think there's something about planting a flag. And we've tried this before, but I'm hoping that with the health technology cluster, part of what this will do will be to promote what we do and to make us a lot more confident and perhaps a bit more bolshy, actually, and recognize that we have got some really good stuff here, and that if we can bring it together and present it, package and present it in the right way, we can really sort of start to motor in terms of the recognition I think that we deserve, not only nationally, but internationally.
Just before I go on to the specific questions that have appeared in the chat, this might be this place to talk about this this combined authority project that David mentioned in his introduction. So this is something we're getting off the ground, hopefully at the beginning of April. It's called DIACOM, the Diagnostics Innovation Community for the West Midlands. And it's this idea of a mini cluster. And what I'm keen to do, it's going to be running through the health technology cluster. What I'm keen to do is to get, instead of sitting here as we always do in the public sector and saying, this is what industry needs, and we give them an array of things that we think they need, I want to get a group of companies around the table, not only emerging diagnostics companies, but also those who have a place in the supply chain, like the precision molders and the people who are providing technology, precision technologies for the automotive industry. Get them around a table and say, what are the things that are stopping us getting to the next level with this, and designing and connecting those queries to the suppliers we already have in the region. I suspect there is virtually nothing we'll have to create from scratch, but I don't know what the needs of those companies are. So what I want to do is to recruit a batch of companies to work with me, to tell me what the problems are, and then set something up to deal with those problems. Tim, you've got your hand up.
Yeah, I mean, I think that would be really helpful. I mean, one of the things from the sort of academic side as well is that what we need is your problems and things you can offer as solutions, because it's that knowledge which allows projects to be put together. And often, because there are gaps between, I don't know what SMEs are producing at the moment necessarily apart from my own. Also don't know what challenges are out there, say in the healthcare. I think getting those things linked together and knowing what businesses want as well and how we can help, I think that helps a lot. And looking at what's going on in the government at the moment, that's sort of, they want that collaborative stuff pushed even further. And so if you can enable that to happen by ensuring we're linked up better so everyone knows what's going on and the companies know what they're getting or what they want to get, I think it can only be a positive.
Brilliant. And actually that came from a conversation I had with Matt probably this time last year when you were producing your lateral flow test, but you were searching around trying to find a supplier for the actual molding to put it in. And I reckon there was bound to be somebody in this region who could do it for you, but you had to go outside of it. So, yep. Chris, do I see your hand up? This is Chris from EduLink.
You're muted.
Sorry, yes, sorry, I was just trying to find the button. That's only yeah, and of course that's an area that we're more than happy to work in, and obviously we know people with ISO 13485 and clean rooms and such like, and I think, you know, going back to your question for industry, industry is a hungry beast to serve people, and what they want to know on the flip side of what you were saying, Tim, is what do you want? And if it's something as simple as a plastic molding, great, you know, that's something they can easily jump around and get to know. And it doesn't matter what sector they're in, obviously, as long as they got the right qualities or they're capable of getting those qualities. And as we've seen with the COVID and PPE, there are automotive companies who have said, heck, you know, I need to move because I don't know what this sector is going to do over the next 6 months, etc., etc. And as obviously as we're seeing, if you're in your petrol side of automotive, you've got to move because that ain't going to be around. And so, you know, using your abilities and skills to manufacture something completely different for this sector is ideal. So, you know, the ability of us cross-correlating wants and needs on both sides. At the moment, from industry, they don't really know. They haven't got necessarily the challenges to bring to your door to say, can you help me develop X? Because what they're looking for at the moment is where their market is, where can they actually make some money? What is the long-term economic goals for themselves? So you bringing the opportunity, you know, even if it's just packaging of your lateral flow tests and etc. And the other side, sorry to carry on a bit longer, is that we've seen lots of industries die over the years because of offshoring. And as David was saying, you know, the ability of reshoring. But, you know, we were the center for making needles at one point. That's disappeared. And what does the world need now? Needles to blinking vaccinate us all. So, you know, sort of a chicken and egg sort of elements that perhaps we need to reinvigorate our industry by showing there is an opportunity to supply there. And then obviously going back to the government is hopefully them landing contracts here so our companies can actually capitalize from them. Sorry, got on a bit.
That's brilliant. Well, thank you ever so much, Chris. No, you're absolutely right. So I think it's a very exciting time for the cluster. I hope we're going to be able to do all the things we aspire to. But I think the thing that's key for us is that this is not just another public sector project that is being funded for, you know, it's a 3-year ERDF project. This has to be driven by the users within it, and it will succeed or fail on the basis of whether it is useful to its members. So I'm keen for everyone to engage with that. Matt, you have your hand up.
Hi. Yeah, it's been a really interesting discussion so far. Thanks. One of the things that springs to mind is that one of the main challenges for us as a SME is funding. And when you go to investors, you want to reduce any concern that they've got around risk. And if you go to an established, say, subcontractor, it would, if you're talking about UK based, it'll probably be Cambridge or Oxford based engineering company for doing your hardware that's got a good reputation, then there's no risk there. It might cost you a bit more money, but the challenge is that if I wanted to promote sort of local sort of engagement there, then it's quite difficult. Not because I don't want to, but I think Chris is wants to chip in there. But
yeah, on the flip of your comment, Matt, yes, an angle that I think which came about from a conversation that I've had this week is which could play in our favour is through your regulations, which is obviously one of the biggest hurdles and funding areas that anybody in this sector is going to challenge, is that if you actually have a local and I mean local by regional or UK, then if you have one of the spot inspections, it's going to be a lot cheaper and a lot easier if the company's around the corner than if your supplier of one of your key elements is in Taiwan or Korea or wherever, because invariably they'll have to go there to audit it. So I think that could be an element which may facilitate us and use. The funding, it depends obviously what you're looking for, and I think that's a whole set of conversations which I'm sure the cluster will be looking at, depending on what part of your journey you're on with regards to developing your tech.
Yeah, thanks, Chris. I was I entirely agree with what you say. I was more thinking about a sort of regional sort of bias rather than sort of national. So yeah,
it's quite a difficult thing to do, but the PPE Collective proved to us that these things can be done. So where there is an opportunity to do so, I think we should. Chris from Nauticus, hi.
Hi, Paddy. Completely agree with what Matt said about getting investment in the Midlands. It's proven hard for us too. So anything that could be, undertaken to improve that would be good. The other thing we've found quite difficult as we've grown really quite rapidly is getting talent in the area.
Really? Because I thought we'd be producing hundreds of graduates.
Yeah, but these are maybe more experienced people in software engineering, software development, bioinformatics. So these genomics, clinical scientists, these are all kind of people who've got experience. And what we found is, are we getting many applicants from, we do get applicants from other areas, but then they're not really willing to move. And we want to do business in Birmingham. So we're getting applicants from Cambridge or Oxford or London, but they're not really, they're quite reticent to move, many of these. So actually finding people locally. And when we were first starting out, what would have been really excellent is what we're finding is that universities around the area have got lots of excellent people, but they're working at the universities or they're working at the local hospitals. And what would have been great is if there was some kind of centrally funded mechanism whereby SMEs and the universities could work together so we could get access part-time or on a paid basis to developers, to software developers or informaticians to help get us off the ground at the beginning. It's no less relevant to us now because we need full-time staff, but I think something like that would have been particularly useful at the beginning.
So something like a secondment or an internship program, things like that. We did actually talk about this in the early stages of the cluster development. Everybody's waving at me. Could I start with Andrew?
Hi everyone. Just to back up what Chris said there, he's absolutely right, and particularly in terms of talent that's going in the direction of software and data analysts and people working in cutting edge areas like VR and stuff. In my discussions with companies, it is a problem to get in that mid to senior level talent from places like Oxford and Cambridge. You're absolutely right, Paddy, about the graduates. We've got lots of the lower level ends, but Chris is not the first company to talk to me about that the talent at that mid to senior level, particularly the way that the tech part of healthcare is moving. Yeah, that is proving to be quite difficult.
So that's definitely something on our list for the DIACOM project to have a think about. So I'd welcome everybody's input on, where those type of gaps lie. Tim was also waving at me. Were you waving at me, Tim?
I was actually just writing something, but yes, I mean, there is plenty of money in the unis to transfer people across, but of course that's only temporary in some ways. But there's, and certainly transferring PDRAs or PhD students, we actually struggle for that. Lawrence is waving mildly. Go on, Lawrence. I'm sure you've got things to say.
I was only going to support what you're saying, actually, which is that universities are already keen to do this. And without giving anything away, we've been working very proactively with that wonderful mega lab development in Leamington, where there really is a concern about the skills base, and we are sharing staff, sharing students, and we hope to use that. I'm talking about the royal we, because if that comes off and it's being developed as we speak, then it's going to create a massive focus for diagnostics in the region. Very important politically, very important academically, very important from the way that we engage with industry. But what they've identified immediately there, because their eventual need is for 2,000 staff, is the technical. And it's not only lab, it's not only what I understand, which is wet science. It's about software development, it's about data analysis. Across the universities, we've got loads of people that do this type of stuff. We're training folks all the time. So I think, as Paddy says, using the DIACOM initiative and the health cluster perhaps to have those discussions with folk and to see what we can do together to help deal with that skills base, because we've certainly got lots of graduates who are very keen, and we can think about opportunities for placements, but also what it means for career development of those individuals.
I remember saying that the definition of a good cluster is that you can change job without moving house. You can do it in Cambridge in biotech. I bet we can do it here.
Yeah.
I think, Ian, did you have your hand up?
Yeah, I did. Thank you, Paddy. I'm University of Warwick. I mean, we have a number of initiatives here. I mean, one of them is something called Employer Connect, where you, as an employer, you can upload details of your organization, and people can search for opportunities. It may not be that you have any particular jobs currently, but you know, you can put a profile of your organization, so if people are looking for internships or some sort of working opportunity. But there are also, we are also doing secondment to other organizations. But I mean, there's a whole raft of different things that have been covered here. I mean, one of the comments I put in there was around, you know, people talk about the Northern Powerhouse, but it's so far away from London that people don't necessarily consider London. But because of our proximity to London, it's quite easy for people to disappear down there. And we've had businesses that we've grown up through our science parks here that couldn't find the right people, so disappear off down to London because of people, and also for investment. So we're trying to close that gap around the investment part, but also the skills part of that as well.
That's fantastic, Ian. Well, you'll definitely be hearing from me, because I'd like to rope you into the DIACOM thing. I've already got Alex Toft involved, but I'd be very keen for your input as well. I'm conscious one of the things we pride ourselves is that we always finish on time. I've got one more hand up, which is Chris's, and then I'll pass to David to wrap up.
Very quickly, I think Lawrence and various other members around here, with regards to bringing in talents into the region, that goes back to Lawrence's comments earlier on. We need to shout one hell of a lot more about why you should be here in the West Midlands working here, and there's opportunities for you and growing. And obviously with the mega labs, you know, there's a lot of universities supplying talent and looking at supplying talent into there. There's going to be a great pool as we move forward for this sort of stuff. So your new DIACOM cluster, you know, concentrating on around that sort of area, in that this is the place to be to do that sort of work, I think will be a great aspect, as well as obviously clustering the current entities here together to show that there's this focus here. Thanks. Sorry.
That's marvellous, folks. Thanks ever so much for all your contributions today. You will be hearing from me, and I hope you'll all be part of the cluster and of DIACOM as we go forward. David, I'd just like to hand over to you to do a wrap up for me, please.
Good, thank you very much. So thank you to Ravi for fronting the event, and thank you to Paddy for managing the question and answer. Just big thank you to Tim and Lawrence for two very, very stimulating and exciting presentations, absolutely demonstrating the can-do attitude in the West Midlands and the skills that we've got. And that leads me to the way that the discussion went from those presentations into the broader issues that span from that. So first of all, that idea about we need to promote ourselves more strongly, and that's something that we're very keen to do. I did put in the chat a link to the government's announcement about the new Health Protection Agency. It's actually called the UK Health Security Agency. This is all of Test and Trace, all of the Joint Biosecurity Centre for the UK, and all of the Public Health England health protection functions. Their science, I think, will be at Harlow, because there's a brand new centre being built there already for the scientists. But what about the headquarters for the agency? I mean, should we put down a marker that we're up for it if they would want to locate it in the West Midlands? And that does show our confidence, and it gets us on the radar, even if not this time, next time. So that's the kind of thing I think you were talking about. And then all of that stuff about attracting talent and building up the access to investment really goes home with me. And I really liked the excitement of the Mega Lab, the opportunities to share staff with universities, and all that mobility around the system and assisting the individuals with their career development to get to what Paddy said about you can change your job without having to change your home is something that we should be aiming for. So I think it is an exciting time for the cluster to be launching, but we will only survive with members. So if any of you are in a position to join as a member, I'd urge you to. And if you know people who you think should be pointed in our direction, I'd ask you to. Please point them to me and I'll give them our spiel as well. So everybody, thank you very much for today. Great contributions, great turn up. And I'm really pleased with everything that's happened. I'll say goodbye now and close the meeting, but thank you all very much indeed for your contributions.